Mesothelioma is a type of cancer that is caused by exposure to asbestos. Asbestos was commonly used in construction materials and insulation in the 20th century before it was banned. Unfortunately, many people working in industries like shipbuilding, construction, and manufacturing were exposed to asbestos and developed mesothelioma later in life. According to data from the Mesothelioma Applied Research Foundation, Georgia has one of the highest rates of mesothelioma in the United States. This is likely due to the large number of manufacturing jobs in the state's history that involved asbestos exposure. The three main types of mesothelioma that develop in Georgia include pleural mesothelioma. Pleural mesothelioma is the most common type, accounting for about 80% of diagnosed mesothelioma cases in Georgia. It starts in the lining of the lungs and chest cavity called the pleura. Common symptoms of pleural mesothelioma include shortness of breath, chest pain, cough, and weight loss. This type of cancer often spreads from the chest cavity to other nearby tissues and organs. Stage 1 pleural mesothelioma is contained to the pleura, while Stage 4 indicates it has metastasized to other parts of the body. Due to typically late diagnosis, many patients in Georgia are diagnosed with Stage 3 or Stage 4 pleural mesothelioma. Peritoneal mesothelioma. Approximately 10 to 15% of mesothelioma cases in Georgia are peritoneal mesothelioma, which develops in the peritoneum. The peritoneum is the thin layer of tissue that lines the inner wall of the abdomen and surrounds internal organs like the stomach, intestines, and spleen. Symptoms can include abdominal pain, swelling, fatigue, and weight loss. Like pleural mesothelioma, peritoneal mesothelioma has various staging levels depending on how far it has spread. Later stages are associated with poorer prognoses. Pericardial mesothelioma. Rarely, mesothelioma can affect the pericardium, which is the sac-like tissue surrounding the heart. Only about 1 to 2% of mesothelioma diagnoses in Georgia are pericardial mesothelioma. Symptoms can include chest pain, shortness of breath, heart palpitations, and heart failure. Due to the pericardium's vital protective function, pericardial mesothelioma has a very poor prognosis compared to other types. Most patients diagnosed with pericardial mesothelioma are in late stages of the disease. Risk factors in Georgia. Certain occupations in Georgia's past put many residents at high risk for developing mesothelioma later in life. Shipbuilding workers. Several shipyards in Georgia's coastal regions like Brunswick and Savannah employed thousands of workers constructing ships. Asbestos was widely used for insulation. Construction workers. Asbestos was heavily used in roofing materials, insulation, fireproofing, floor tiles and other building products until the 1970s. Many construction workers were exposed. Industrial workers. Georgia had numerous asbestos product manufacturing plants. Workers faced possible exposure to asbestos fibers. Auto mechanics. Asbestos was used in motor vehicle brake pads and gaskets. Breathing asbestos dust was a risk for mechanics. Railroad workers. Railroad workers labored with steam-powered locomotives that used asbestos for insulation and in brake pads. Military veterans, workers at Navy shipyards, and some veterans may have been exposed to asbestos. Prognosis for the different types of mesothelioma found in Georgia depends on various factors like staging at diagnosis, patient health history, and treatment options received. Unfortunately, most patients are not diagnosed until later stages. Average prognoses tend to be pleural mesothelioma, 12 to 21 months after diagnosis of Stage 4 disease. Early stage tumors confined to the chest cavity have much better prognoses. Peritoneal mesothelioma, 20 to 30 months for Stage 4 tumors after diagnosis. Early stage tumors have 5-year survival rates as high as 50%. Pericardial mesothelioma, average survival is only 4 to 9 months after diagnosis. Due to late stage detection, this type is almost always fatal. Treatment options available in Georgia that may help extend survival times include chemotherapy, radiation, surgery, and newer immunotherapy approaches. However, mesothelioma remains very difficult to treat fully. Early detection is key to providing the best chances with existing therapies. Unfortunately, reliable early detection methods have yet to be identified. Ongoing research seeks to find better screening tests, more effective medications, and potential cures for mesothelioma. The Mesothelioma Applied Research Foundation supports several research programs at hospitals in Georgia working towards these goals. Until treatment develops further though, prevention remains vital for those at elevated risk for mesothelioma in Georgia and nationwide.